Patients come to MedStar Orthopaedic Institute because they get treated by the best of the best. One proud segment within the MedStar Orthopaedic Institute is our foot and ankle team. The foot and ankle team is known internationally for its research, its teaching, its innovation, and really the progressive care they provide to all of our patients.
At MedStar Orthopaedic Institute, we cover a wide range of problems, from trauma and fractures all the way to chronic conditions and debilitating deformities.
At MedStar Orthopaedic Institute, we service patients with a wide variety of foot and ankle complaints. These include things such as bunions, foot arthritis, tendonitis, fractures, sports-related injuries, even complex reconstructions and ankle replacement.
The Foot and Ankle Division at MedStar Orthopaedic Institute uses technology, we use our people, and we use a vast amount of clinical knowledge to come to bear on individual patient problems.
I think there's three things that make us stand out. First, I think we're known internationally for our teaching and research. Second is that we have the highest quality outcomes and really the cutting edge techniques. Third is that it's how we treat people. We're known throughout our communities as being the best, highest quality providers in the care.
The leadership of the hospital was very supportive of research and gave us resources that we needed to start growing the program, with the idea that we could expand in all the subspecialties, especially foot and ankle surgery.
We have some wonderful research labs here at MedStar Orthopaedic Institute that allow me to apply the technology from the lab to the patient in a meaningful way.
We have a basic science laboratory, a biomechanical laboratory, and we're engaged in clinical research every day.
The most important thing that we do in the labs is test either new methods or test pieces of equipment, in other words, new orthopedic devices, to see how effective they are before they get to the point of being implanted into patients.
These pursuits help us drive innovation and bring new products to market to better serve our patients.
We do clinical research and we do bench lab research, all of which are designed to give us new insights into the procedures that we performed, and more importantly, the outcomes of the procedures that we've been performing traditionally. All of that's leveraged to provide the best patient care in the future.
MedStar Orthopaedic Institute Foot and Ankle Care is nationally recognized because of our educational component. We teach residents, we teach fellows, we do research, and then we can apply that to patient care.
I'm the program director for our orthopedic residency program, which is a training program for future orthopedic surgeons. Having an orthopedic residency program is important. Not only are we orthopedic surgeons, but we're also role models for future orthopedic surgeons.
I feel like we have attracted and trained some of the most talented foot and ankle fellows in the country. And it's exciting to go to the national meetings and see all of the people that we've trained are doing presentations. They're chairs of committees, they're department chairmen, and they're making innovations in foot and ankle surgery throughout the country and even the world.
Over the last decade, so much has changed and evolved within foot and ankle care. Just like in healthcare, there's constantly change. Our providers are really at the forefront of that change. They're teaching the next generation of physicians. They're going to go out into the world, treat those patients in a more progressive way. And really our quality outcomes, the length of stay, patients are really going home quicker, healthier, and faster.
Orthopedic foot and ankle surgery is evolving. We're offering some of the new and most innovative treatment options available.
This includes minimally invasive bunion correction and complex joint replacement options for ankle arthritis.
There's been a new emphasis on biologics. There's been a new emphasis on minimally invasive treatment. There's a lot of new things that are being done with regard to sports injuries, combining those two facets of care together. We're doing all of that here at MedStar Orthopaedic Institute. A weight-bearing CAT scan, for instance, is one of the new pieces of technology that we've obtained. That allows us to get very fine-cut, three-dimensional images of the foot and ankle taken with weight on the foot. So you actually see how the joints interact, you see what bones are impinging, and what the relationships are. That's a new level of insight into deformity and pathology.
We treat people like they're our family. You see all of our providers come to work every day with one mission. Whether you're a nurse or you're a technician or you're a surgeon, it's caring for those patients with really true compassion, like they're your family member. You want the best for them each and every time.
To make patients feel comfortable is not an easy task sometimes. I think it's really important for us to sit down, to bring ourselves to the level of the patient and address the issues that they're having. If it means we take an extra 10 to 15 minutes to talk to them, then that's what we have to do. It also is very helpful to make sure patients know that they can call us at any time and they will have someone to address all of their questions and concerns.
I think you come to MedStar Orthopaedic Institute because of trust. The doctors are subspecialists, they're good, and they take care of people like their family. In fact, this is where I would, and I do, send my family members for their care.
Personally, I've had 2 foot and ankle surgeries here and gotten excellent care. In addition, both of my sons, unfortunately, have torn their Achilles tendons and had them surgically repaired here. Across the board, we've gotten excellent care from the secretaries on up through the nursing staff and the surgical staff, and I always recommend that people come here.
We have a great team and a wonderful staff that works so well together. The team is absolutely geared towards making people feel better, recover faster, and promoting good health overall.
In terms of the Baltimore area, there's no better place to be for foot care than MedStar Orthopaedic Institute, and it all comes from the people that are here. All the doctors, all their assistants, everyone will provide the best experience possible.